Hello and welcome to another episode of Lab Insider. My name is Maximilian, and joining us is Zisis Kozlakidis of the World Health Organization, as well as the International Agency for the Research of Cancer. He is head of laboratories and biobanking and is here to join us. Welcome, Zisis.
Thank you very much. Thank you for the invitation and the opportunity.
Zisis, it is really wonderful to talk to you. We've covered a lot of things in our pre-discussion, so this episode is going to feature quite a lot on very worldly topics. But before we begin, do you mind telling us a little bit about your background and what your current position is?
Currently, I'm the head of laboratory services and biobanking at the International Agency for Research on Cancer. It is an executive agency of the World Health Organization. So to put it very, very simply, let's consider ourselves as the in-house labs for the World Health Organization with a particular focus on cancer. And we also are responsible for one of the largest collections of biological samples in the world, where we've created a biobank that administers and manages samples and associated data for over 7 million individuals from across the world for different studies relating to cancer, to exposure to different chemicals and so on. My particular background is in microbiology, in virology specifically, and I've been very active in designing molecular-based diagnostics. Having said that, because we always needed a validation step in the diagnostics in order to bring them to the market or progress to the next stage, I got very involved in biobanking and how do you procure these tissues, this material that actually is used to validate all your hard work. So I've been moving with these two hats from that point onwards. Another part of my work relates directly to innovation and how do we create innovation that becomes part of routine healthcare provision? Because we see innovation all around us.
Right.
What becomes part of our routine life is quite an interesting question because that will differentiate effectively how we live our lives.
What I'd like to know is actually the state of these innovations, because there is an abundance of technology out there, but are we implementing it correctly? I mean, what's the state right now?
If you look, it depends on your horizon, actually. So if you look year to year, you might not be very impressed. But actually, if you look over the last 2 decades, it's quite an impressive development. So 20 years ago, we were only just about talking about the Human Genome Project and the impact it's going to have on our lives. The level of understanding of our genomics and the technology that's behind it has leapfrogged since. So the state of innovation is quite good. The state of digital diagnostics is quite good in the sense that there is consistent production of new ideas, new techniques. There is advancement. Where there might be a lot less of a success story is in the integration of all this success into our daily practices.
Right, because you've mentioned the infrastructure is there. The inventions have been invented, but the rollout is where the challenge is.
Yes, I mean, we of course have to put some caveats because the world is not a unified space, so you see different speeds and different infrastructures in different parts of the world. But on the whole, if you're looking to innovations that are heavily relying on, say, for example, communications infrastructure, then the communications infrastructure is already there, working well and available for large parts of the world. So, for example, if we look at Southeast Asia, there is an incredible amount of communications infrastructure that's already used by the public on a daily basis.
Right.
And then the question is, why is the healthcare not taking better advantage of the infrastructure that's already there? and implementing all this digital innovation.
There is a high what they refer to as mobile penetration among citizens in Southeast Asian countries. You've also mentioned that there are other indirect origins for advanced tech. I think it was it Kenya that you might have mentioned that the telecommunications technology is another great sort of groundwork for using healthcare apps.
Oh, absolutely, yes. To start with Southeast Asia, for example, the penetration is beyond 100%. So it means that almost everybody has a phone, and most people have more than one phone. So their accessibility to information is near immediate. Not everywhere, of course. Yes, there are caveats. It's not all the same, but in general, there is an incredible amount of development in that part of the world. Now, when it came to the current pandemic and trying to deal with SARS-CoV-2, in Indonesia, for example, they were able to roll out an information spine, so an information data silo, data lake, if you like.
Yes.
Where the information would come standardized from different parts of the public. So that could be hospitals, primary care centers, the police, the army. So all this information would be standardized onto a central database, and then it would be interpreted in different dashboards for the different public health users. So you have a common point of integration and a common point of source for all this information. And that was possible because the infrastructure was already there. So effectively they used what was then built on it. That was because of an emergency response, and that was because they were focused on solving a major problem they had in their hands. But I see no reason why this cannot be done, for example, for other cases, whether it's infectious disease surveillance or even non-communicable diseases, where you have to do post-operative follow-up for patients over a long period of time.
You have outlined, because there are parts of the world that are more capable than others, because everyone can be willing. But which environment have you identified geographically that seems to be the best prepared, the best environment for rolling out these technologies?
According to my opinion, and it's only my opinion, what I've seen from the Nordic countries in Europe is very successful and very effectively done. We have to put a very big caveat to say that they've raised the bar for the data protection really high. So it comes with an upfront cost and investment in creating this secure data environment. But having done that, the integration of the data is very effective, which means that when you have some intelligent way of processing and interpreting the data, it can be rolled out, and it can be rolled out effectively, and the population then has an understanding that this is done in a safe way and the data is protected.
These environments are particularly attractive because, as you just mentioned, that the bar to entry, it's very high, which in a way acts like a quality control. It's it naturally selects which firms, which producers are effective enough to enter. They're deserving. But once they're in there, these strong institutions, these data protection laws, are there in place to make sure that, no matter how you use the data, you could integrate it with anything. You said social care as well is a possibility.
There is the possibility to look into wider sets of data. So you can have data sets that relate to consumer behavior and data sets that relate to environmental exposure or to the social aspects like educational aspects, and bring them all together into a safe environment. It's complicated, it's difficult, but it is possible. And I think this is a place where we will start seeing new ideas and innovation coming out from. because suddenly you can do all these combinations. Yes, it will only be the 5 top of the class institutions that will be able to do that, but at least there will be the proof of principle that it is possible, and maybe that's the way forward for a wider part of the world.
You've outlined quite a few applications for this, the things that we can come to expect in the future, in predicting things, right, before they reach their peak.
Yes, I think that's a necessity because of how our systems work. So if one looks at healthcare altogether, we consider healthcare within its acute phase. So I've got something, I go to the doctor or to the hospital to get better. And this is the very narrow view of healthcare provision. Within that narrow view, the systems are working at almost maximum capacity in many places. In fact, in many places, capacity is not sufficient to provide for the demand that we see. So if we are to really make a difference, the blue oceans, the opportunities that we see are not in this narrow space, but in the space upstream where you predict things and you prevent them from reaching this acute phase, or downstream. So once things have happened, you monitor them remotely, or you create an environment where you reduce this face-to-face interaction with the healthcare system, but you still maintain the interaction in the digital side of it. So these are the two spaces, upstream and downstream, where the opportunity lies at the moment.
What do you think is, just as a final note here, what kind of outlook do you have with this? Do you think we're ready?
Personally, I'm a very positive, very optimistic person. So I would say yes. But probably I would say we still have a lot of learning to do. So as part of the learning, there are success stories and there are stories that have been less successful. And we should be able to embrace both and learn from both. So one of the big questions that we have at the moment is that we have all this amazing technology, but it cannot all be applied in the same way in all regions of the world. So there needs to be some element that is very context dependent to allow this innovation to flourish and be integrated. And I'm not sure that we fully understand how to create this context dependency in digital innovation. And I'll give you an example that comes from the labs, but it can be reflected on digital health. So we talk about, for a lot of the tropical countries or resource-restricted settings in the equator, that the equipment that we provide for the labs need to be tropicalized.
Tropicalized?
Yes, because if you open a catalog and you order a freezer or a centrifuge, it will arrive. That's not the problem. But it might not behave in the same way that you expect it to behave because all the tests have been done in conditions that are not reflective of the tropics. And that might have an impact on your electronics, your electricals, on the lifespan of your equipment. So in the same way, we need to think of digital health, that there needs to be some element of customization to make it successful. We cannot keep standing on this technical argument saying, oh, this is fantastic because it can do A, B, C, and D, and then throw it over the fence for somebody else to deal with and make it work in their local context. We have to be a lot more proactive and creating these conditions that will allow the customization to take place.
Zisis, thank you very much for your insights.
You're welcome. Thank you for the discussion.
That was Zisis Kozlakidis of the World Health Organization, also working with the International Agency for the Research of Cancer.